It's time to talk about your health this morning at 8:12. Some good news when it comes to cancer. Research shows cancer death rates are steadily on the decline and have been actually for the last 25 years. And although cancer remains the second leading cause of death in the United States after heart disease, the mortality rate dropped just by about 2% between 2016 and 2017. That translates to more than 2 million lives saved. So between breakthroughs in research and people maybe taking better care of themselves or getting screened earlier, there are plenty of factors involved in this. So Dr. Thompson is joining us this morning with a closer look at the numbers. It's not often that we hear any good news when we, are talking about cancer, because we still don't have any cures, and it seems to tear families apart. It's hard to not know somebody who hasn't been impacted by cancer.
Yeah, this is such great news,
yeah.
and we're at a moment in time where any good news is welcome. Mm-hmm. Cancer continues to be a devastating diagnosis in so many circumstances. But in this case, we have a triumph of science in terms of new medications that work well for certain kinds of cancers, and also good behavior. So Americans are smoking less, and that has cut lung cancer rates dramatically. So between getting better screening, going in for your colonoscopy, not smoking, and science and technology and developing new medications, we got some good news.
You would never want to deal with a cancer diagnosis, but obviously some are much worse than others in terms of statistics.
Sure.
So some of these that are caught earlier, what are we seeing having the best prognosis for recovery and for people finding themselves to be cancer-free?
So we've actually made a lot of progress in terms of screening. So cervical cancer screening is one of the most successful screening tests developed. And women are very good at doing it. So now we know that cervical cancer is caused by a virus. And so we can detect that virus and prevent the cancer from occurring. There's also a vaccine against that virus. So in years to come, we'll see a lot less cervical cancer. So that's one. Lung cancer is another one where we have therapeutics that are working really well, and the therapies that have been developed help boost your immune system to actually stop the cancer cells. So that's an amazing breakthrough.
Wow.
I think we're going to see that more and more across different types of cancer, different body parts, where we use the immune system to help get rid of the cancer. But I also want to mention that if you're a heavy smoker, if you're still smoking, the recommendation is that you get a CAT scan, a kind of imaging, to look for those early cancers. And so we're still trying to get more and more people to recognize that they should come in for that.
And there's a lot more talk and awareness about some of the industries that put you at higher risk for lung cancer as well, and encouraging people to be screened if they're a firefighter or maybe working in construction where they're around smoke, or even secondhand smoke, I suppose.
Yeah, secondhand smoke we know has an impact, and definitely if you're breathing in a lot of particulates, firefighters, especially with wildfires, where there's lots of smoke and particles in the air, that you might want to talk to your doctor about what screening should you do.
Specifically because of your practice, obstetrics and gynecology, ovarian cancer continues to be one of the most deadly.
It does. Unfortunately, when we pick up ovarian cancer, it's already in an advanced stage. And there are labs and scientists all over the country working hard on trying to find a better screening test for ovarian cancer. To date, we still don't have one. Important thing to know for women out there is if you start feeling new symptoms that are bothersome and last more than 2 weeks, like bloating or changes in your appetite, changes in your waistline, but your weight hasn't really changed, don't delay, go in. Go in and get checked out. That sometimes is the only signal that we have.
And generally for the screening, even say an ultrasound doesn't show that?
Unfortunately, no.
Wow,
There have been studies looking to see if ultrasound would pick things up earlier, and it doesn't. Ovarian cancer tends to move pretty quickly.
What other advice lifestyle-wise would you suggest to your patients, your friends, and your family so that we can minimize our risks?
You want to combine the things that you can choose, exercise, eating those vegetables that I always talk about, and going to see your doctor and getting their advice. Because things change rapidly. So because you had a screening test a year ago or 5 years ago, don't skip your appointments for 5 years, because things do change. So you want to stay up to the minute in terms of what's the best thing for you to do.
And sometimes families are just really bad about giving you a clear history of who had what, and no one can remember what your aunt had on this side of the family and whatever. So the better picture you can have, maybe writing that down and having that for your doctors.
Write it down. I recommend recommend all the time, this is what you should talk about at Thanksgiving
Okay.
and Christmas, not politics. Talk about your family medical history.
It's safer, right?
It's safer.
Dr. Sharon Thompson, we so appreciate you sharing a little bit of good news from the medical world and also some great advice.
Thanks for having me.
Thank you.